current state of telemedicine in cardiology is an interesting one right now. The research in telemedicine in cardiology has been going on for probably 10 years at one level or another. In some cases it was, let's call it telephone communication with voice messaging. That evolved into internet-based communication, but it was always a method for a patient with heart disease to accumulate their own data. They make their own data measurements and report that information to a provider so that they could get feedback on their care. The telemedicine and cardiology research has basically pointed out in most cases that patients with these chronic conditions like hypertension, like heart failure, like hyperlipidemia can improve their status by using telemedicine reporting and telemedicine communication with the practitioners and the patients. So as it stands right now, we have the tools. We have plenty of media tools, electronic tools for communication, and there have been a number of studies in telemedicine that pointed out value in improving both blood pressure control and in particular heart failure control in patients that use the telemedicine system. Now, to be honest, there have been a couple of studies that demonstrated no value of telemedicine in use, particularly in heart failure. Part of the problem with telemedicine is the need for cooperation by the patient. That is, if the patient's at home making measurements, obviously they have to make the measurements, and second, they have to communicate the measurements back to their practice or their caregivers. That motivation is the biggest problem in telemedicine right now. I mean, basically, we can find studies where the communication was established, but the patients didn't communicate enough or didn't communicate at all with the practice and basically didn't benefit. The future of telemedicine cardiology is compelling in the sense that we can't ignore the new communication tools that we all use every day, you know, voicemail and text messaging and things like that, that allow the patient and the physician to communicate back and forth with the status of the patient to the doctor, and then information from the physician on what to do about their health care. So from that standpoint, there is a need for this, and because cardiology is developing methods to keep people living longer, we're living in a world of very many chronic disease patients who are stable on medication but need surveillance. And these are not the kind of patients you can see 2 or 3 times a year. These are the kind of patients where you need to be communicating on a weekly basis just to make sure things are stable. So I think from the standpoint of the future, 2 things have to happen. One is that we have to get patients motivated to use these kind of systems in chronic disease models. And again, I'll use heart failure and hypertension as 2 important chronic disease models in cardiology. So the first thing is to get the patients to participate, and the second is to make it convenient for the patient so that they can transmit data back and forth without a lot of extra hassle in getting the information transmitted.